quest for perfection through plastic surgery. We've heard some horror stories and some that have worked out. Well, back to show us the hottest new procedures in plastic surgery is Dr. Ghavami, my favorite plastic surgeon. Okay, so what is the trend, the latest trends in plastic surgery?
I would say the buttock shaping is one of the hottest right now, and there's also less of a stigma with rhinoplasty or nose jobs. You can be of any ethnicity now, Asian, African American, Middle Eastern, Hispanic, get a nose job that's done ethnically congruently. In other words, it matches your face, and pretend that you were born with that nose. It's just more in balance, and it's subtle. Like we said, less is more. Another trend is not going very big with implants. I don't put large implants in because over time they end up in your belly and it's like rocks in a sock. And that is not a good look.
No. All right, well, you know what? We brought some examples of what is going on in plastic surgery these days. Let's take a look at our model before. Okay, and what was she having done?
She had a breast augmentation. She's a mother of 2. And the way I do my breast augmentations, I call it Flash Recovery, which means that she went back to her job essentially the next day, went to the mall. I did not prescribe anything but Tylenol and a Motrin. And the procedure took less than about 30 minutes and essentially no bleeding. And with a smaller implant.
Okay, and so how does that work?
We go under the muscle with a breast implant, but because there's no bleeding, there's no staining and bruising of the anatomy or the rib cage, there's essentially no pain. You know how bruises hurt?
Yes.
When there's no bruises, there's not a lot of swelling and bleeding, then there's almost no pain.
So this is a relatively new procedure.
Well, the guy that invented it in 2002 taught me, and I don't know of any other way to do breast augmentation, but for a lot of people, they haven't heard of this, so it is new.
All right, well, let's bring her on out. You look amazing.
Thank you.
Okay, everyone's like jaws on the floor. I mean, I think you look beautiful in the other picture as well, but that looks so natural.
Yeah, I really like it.
And did you really go back to work the next day?
Yeah. I went out to dinner that night and I went to dinner, I did everything the same way.
Wow.
It didn't hurt, or it just felt like pressure.
Wow. How long ago was it done?
It was done in 2010.
Wow, you look amazing. Thank you so much. Thank you. Tell us, I mean, I have to say I'm a little more interested in this procedure than any other. What is the muffin top procedure?
The muffin top procedure, or I call it the S-curve, is I take fat from everywhere in the body. Some people call it Brazilian butt lift, but I don't like that term because why should one country get the credit, first of all? Second of all, you have fat all over your body, so my focus is not just the butt. I want to create harmony in the whole body and create those beautiful Marilyn Monroe curves.
So that's a before picture.
This is before, so she has a lot of fat around her midsection, and she has a big muffin top, and her buttock kind of looks like it's lost in there. It's a little flat. When I transferred all the fat from everywhere in the body, then she got this beautiful round posterior, and everything is more blended, and this is fat.
Are you kidding me?
Yeah, that's her. And if you go on my website, you can see all angles of her buttock. We can't show a lot of nudity here, but you can see the bottom of one of her tattoos. It is definitely her.
Wow, wow. Thank you so much for shedding some light on this, really. I'm a little more interested than I thought I'd be.
My pec implants were the most difficult because they had to cut you under the arm and undermine all the muscle tissue and stick like the implant in through the armpit. And truthfully, I couldn't move my arms for a couple weeks. I had to basically go through rehabilitation to move my arms.
But it was worth it, you say?
It was worth it.
Okay, well, I want to bring in Dr. Ghavami into the conversation. As a plastic surgeon, would you ever cut off a patient who keeps coming back for more and more surgery?
I do it all the time. One of our jobs as a plastic surgeon is we're physicians first. On the first day of medical school, we take an oath that we do no harm to patients. So first and foremost is the health and safety of the patient. Safety also means mental health safety. So if somebody's actively going through a divorce or they're grieving the loss of a loved one, I don't even do surgery in that time period because they're not of stable sound in mind. And if somebody's coming back for repetitive procedures, it's a red flag to me. And I say no all the time because to me, I want my work to be natural. I want someone to be able to say, essentially keep me a secret. and to not say that they had anything done. I just like to operate on patients who have a little bit wrong here or there, or they're aging, and you do 1 or 2 procedures throughout their lifetime.
More.
Yes.
So in the case of Steve, I mean, not to put you on the spot, but is Steve someone, if he came into your office, would you turn him away possibly?
I actually would, yes. And I would actually try to ask him if he is seeing a counselor or a therapist to see if there's other things that are leading to these procedures that can be dealt with the root of the problem. It's a fairly complex surgery, but I've done it before, and you know, a lot of people are getting these bargain injections. They don't know what it is, and I've seen people with horrible complications that we have to do a 2 or 3 stage operation to reconstruct and rebuild them back to normal.
Wow, wow. Dr. Ghavami, do you see many patients like Melanie, stories that they went to other countries to get it done cheaper?
Yes, you know, this is a very important show because safety is so important, and you do not want to bargain shop for your plastic surgeon. This is your body you're talking about. It's a sacred temple. I mean, you do not want to risk it by going to someone who's not certified by the American Board of Plastic Surgery. Being certified by the American Board of Plastic Surgery is like a car having wheels. It's the basics. Beyond that, then you want to see how stylistic and aesthetic and how the work of that surgeon is as an artist. So you're always a physician first and a plastic surgeon and an artist of the body second. When you're going to another country like Colombia or South America, not that they may not have qualified plastic surgeons, but you don't know who's doing what on you. There's no laws, there's no regulations on it, and you have to leave that country to come back with all the possible risks, and they're
germs, even just traveling back home.
Yes.
You know, right?
I mean, I have a lot of people coming from Saudi Arabia, from outside of the country to visit me. I have, you know, princesses and foreign dignitaries, but they come and stay for about a week or 2 or longer until they know that they're finalized with their healing, and I have them go to recovery hotels where they have nurses. There's a right way to do things and a wrong way. You do not want to bargain shop for your body. Unfortunately, my practice, they have no choice but to wait a little bit because I am booked up for a little bit. But occasionally I get patients from out of the country, and I'll talk to them over the phone or Skype consult, and I'll see them 2 days before the surgery. So that happens a little quicker sometimes.
But it seems to me like you're a unique doctor. Do a lot of doctors really sort of take their time with their patients? They have to keep their practice going, I'm guessing.
You know, I'll be very honest with you. The reason we're seeing complications like your patients is because we live in a greedy world. I trained as a plastic surgeon because I love the human body anatomy and I like the artistic aspect of it.